Good morning, friends. You're most welcome to Think Eyes channel. Today we are going to discuss India Yearbook 2022 GS Score, an institution for civil services. Let us begin the topic. First of all, we will discuss about the content. First is dealing with the pandemic. Second, the land and people. Third, polity. Fourth, defense. Fifth, law and justice. Sixth, India and the world. 7. Basic economic data. 8. Finance. 9. Corporate affairs. 10. Commerce. 11th. Industry. 12th. Labor, skill development and employment. 13th. Health and family welfare. 14th. Education. 15th. Welfare. 16th. Agriculture. 17th. Food, civil supplies and consumer affairs. 18th. Planning. 19th. Rural development. 20th. Housing and urban affairs. 21st. Transport. 22nd. Energy. 23rd. Water resources. 24th. Environment. 25th. Communication and information technology. 26th. Mass communication. 27th. Culture and tourism. 28th. Youth affairs and sports. 29th. Scientific and technological development. 30th. States and union territories. 31st. General information. Let us begin the topic. First chapter is dealing with the pandemic. The beginning. On December 31st, 2019, the World Health Organization WHO was informed by the national authorities in China of cases of pneumonia of unknown causes in the Chinese city of Wuhan. The Chinese authorities identified a novel virus, namely coronavirus, as the cause of the pneumonia cases. Coronavirus (CoV) are a large family of viruses that cause illness ranging from the common cold to more severe complications. By March 2020, the rapid increase in the number of cases outside China led the WHO to announce that the outbreak could be characterized as the pandemic. Reservoir and origin. A WHO report of March 2021 stated that humans spill over via an intermediate animal host was the most likely explanation, with direct spillover from bats next most likely. Introduction of the virus through the food supply chain at the human seafood market was considered another possible but less likely explanation. For a virus acquired through a cross-species transmission, rapid evolution is expected. Coronavirus in general have high genetic plasticity, but viral evolution of SARS-CoV-2 is slowed by the RNA ribonucleic acid proofreading capability of its replication machinery. Animal connection. Bats are considered the most likely natural reservoir of the SARS-CoV-2. Differences between the bat coronavirus and the SARS-CoV-2 suggest that humans may have been infected via an intermediate host, although the source of introduction into humans remains unknown. COVID arrives in India and government response. The increasing magnitude of the outbreak in India called for preemptive, proactive, graded, whole of government, whole of society approach built around a comprehensive strategy to prevent infections, save lives and minimize the impact. Janta curfew and 21st day lockdown was quickly enforced to curb the immediate threat. 21st day lockdown means 21st March. Standard operating procedures SOPs were formulated and released related to the movement of people stranded at different places within the country, including migrant laborers. Seamless availability of essential items was also ensured in an organized and efficient manner, with the aim of bringing home the Indians stranded in many countries due to the pandemic. The government launched the Vande Bharat mission. Breaking the chain. The government allowed the test, track, and treat strategy diligently. The government prepared about 60 guidelines or SOPs or advisories for the management of COVID 19. These guidelines included: first is medical emergency planning, second, availability of hospitals, isolation and quarantine facilities, disease surveillance and testing, third, ensuring availability of essential medical equipment, fourth, augmenting human resource and capacity building, fifth, supply chain and logistic management, sixth, coordination with the private sector, seventh, economic and welfare measures, eighth, information communication and public awareness, ninth, technology and data management, 10th, public grievance, 11th, strategic issues related to the lockdown. Economic support. Immediately actions were taken by the administration and 1.7 lakh crore relief package under Pradhan Mantri Garib Kalyan Yojana PMGKY was released for the poor to help them get over the economic fallout. The Prime Minister on May 12, 2020 announced a special economic package and gave a clarion call for Atmanirbhar Bharat. The package, combining the earlier COVID 19 economic packages and decisions taken by the RBI, was summed up to 20 lakh crore, equivalent to almost 10% of the India's GDP. Free food grains worth 8 crore were provided to migrant laborers and their families. Additionally, on May 13, 2020, to strengthen India's fight against the disease, PM CARES, Prime Minister's Citizen Assistance and Relief in Emergency Situations Fund Trust allocated 3,100 crore to be used for the purchase of ventilators, relief measures for migrants and vaccine development. Medical infrastructure. A three-tier arrangement of health facilities was created for the appropriate management of infected cases. It included COVID Care Health or COVID Care Center with isolation beds for mild or pre-symptomatic cases. Second, dedicated COVID health centers DCHC with oxygen supported isolation beds for moderate cases. And third, dedicated COVID hospitals DCH with ICU beds for severe cases. Tertiary care hospitals under ESIC, Defense, Railways, Paramilitary Forces, and the Ministry of Steel were leveraged for case management. Guidelines on clinical management of infected cases were issued and regularly updated and widely circulated. The country's public health efforts were strongly supported by its researchers and development capacity in developing vaccines against COVID 19. India is one of the largest global suppliers of vaccines, producing nearly 60% of the world's vaccines. The National Task Force on Vaccine Development was formed in April 2020 to set up the process for coronavirus vaccine development and provided the necessary impetus in this direction. FSSAI, Food Safety and Security Authority of India, also released an e-handbook on Eat Right during COVID-19 for citizens, which highlights safe food practices to be followed diligently and tips on the health and nutrition. IT to rescue. IT, Information Technology, to the rescue. COVID-19 National Teleconsultation Center CONTEC was started by AIIMS Delhi. Its aim was to cater to doctors from anywhere in the country who wanted to consult AIIMS faculty for the management of COVID. eSanjeevani, a web-based comprehensive telemedicine solution, was utilized to extend the reach of the specialized healthcare services to masses in both rural areas and isolated communities. An interdisciplinary Ayush R&D task force, R&D means research and development task force, was formed to prepare clinical research protocols for the Ayush prophylactic studies and add on the intervention on COVID-19 positive cases. DOS, denial of services, and don'ts, do's and don'ts, that is not denial of services, do's and don'ts were widely circulated through SMS. Caller tunes messages were sent to telecom subscribers in 13 languages. Dealing with the oxygen crisis, an anti-COVID drug 2DZ was launched on May 17, 2021. The drug reduces the dependence of patients on oxygen administration and has the potential of getting absorbed differentially and in a selected manner. The PM Cares Fund Trust had already allocated 201.58 crores for installation of additional 162 dedicated pressure swing absorption PSA medical oxygen generation plants inside public health facilities. Further, to address the shortage of oxygen tankers in the country, the central government imported 20 cryogenic tankers of 10 metric ton and 20 metric ton capacity and allocated them to the states. A plant of 1 metric ton capacity was built by DRDO with assistance from the PM Cares Fund. PM Cares also allocated funds for the installation of 500 medical oxygen plants across the country. Oxygen Express were started by Indian Railways on April 24, 2021 to provide respite to the states requiring medical oxygen. As part of Operation Samudra Setu 2, 7 Indian naval ships were deployed for shipments of liquid medical oxygen filled cryogenic containers and associated medical equipments from various countries. It must be noted the Operation Samudra Setu was launched in 2020 by the Indian Navy for repatriating the Indian citizens stranded in the neighboring countries back to India. It must be noted the Operation Samudra Setu was launched in 2020 by Indian Navy for repatriating the Indian citizens stranded in neighboring countries back to India. Dealing with the black fungus, even as the country was dealing with the surge of the COVID-19 cases, another threat posed by a fungus, Mucormycosis black fungus was being reported in few patients during the post-recovery. The Government of India proactively made all-around efforts to ramp up the supply and availability of amphotericin B antifungal drug for the treatment of mucormycosis and supplemented the domestic availability of this antifungal drug through import. Care for children. A special scheme PM Cares for Children was launched for the children who lost both the parents or surviving parent or legal guardian or adoptive parent due to COVID-19 crisis. Under this scheme, all such children will get a monthly stipend once they turn 18 and a fund of 10 lakh when they turn 23 from PM Cares for their personal and professional use. Beside the financial support, free education will be ensured for such children and they will also be assisted to get an education loan for higher education and the interest will be paid by the PM Cares. Also, all such children will be enrolled as a beneficiary under Ayushman Bharat scheme PMJAY with a health insurance cover of 5 lakh and the premium amount of these children till the age of 18 years will be paid by PM Cares. World's largest vaccination drive. Phase 1 of the National COVID-19 Vaccine Strategy was launched on January 16, 2021 that focused on protecting healthcare workers HCWs and frontline workers FLWs. Phase 2 initiated from March 1, 2021 focused on protecting the most vulnerable population, persons above 60 years of the age and persons above 45 years with associated specified comorbidities. This further relaxed to include all people above 45 years of the age on April 1st. In Phase 3 initiated on May 2021, everyone above the age of 18 become eligible for the vaccine. COVID-19 vaccination continued to be free for eligible population groups in all the government COVID vaccine centers. Ministry of Civil Aviation MOCA launched the Medicine from the Sky project in Telangana, under which drugs and vaccines were delivered using drones. Permissions was granted to ICMR, Indian Council for Medical Research, for conducting experimental beyond visual line of sight BVLOS vaccine delivery in Andaman and Nicobar Islands, Manipur and Nagaland. Permissions were granted to ICMR for conducting experimental beyond visual line of sight vaccine delivery in Andaman and Nicobar Islands, Manipur and Nagaland. India's foreign policy is governed by its age-old maxim of Vasudhaiva Kutumbakam. The world is one family, which prompted India's unique initiative of Vaccine Maitri, vaccine friendship, effort by different ministries and departments. First one is Ministry of Health and Family Welfare. Specific packages were notified under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana AB PMJAY for testing and treatment of infection. An express empanelment mechanism, Hospital Empanelment Module HEM, light was launched for empanelment of hospitals. Indian Red Cross Society. In an initial phase of the outbreak, volunteers were trained and awareness and prevention programs were conducted to sensitize people and vulnerable communities. CoWIN app. The CoWIN app was developed to track and support vaccination across the country. The app has also been integrated with DigiLocker and Umang for getting certificates of vaccination, telemedicine solution, eSanjeevani OPD. Now discuss about the Ministry of Home Affairs. Screening people entering India in view of virus threat. Ministry of Home Affairs asked private agencies to avoid layoffs during lockdown. Unhindered movement of essential goods ensured during lockdown. Issued advisories to the states and union territories to make adequate arrangements for migrant workers, students, etc. Took measures to fight fake news in order to prevent COVID-19 panic. Defense Research and Development Organization DRDO. In the time of the need, DRDO transformed itself from missile maker to mass designer for saving lives. COVID care hospitals created makeshift hospitals. IgG antibody ELISA detection kit. Anti-COVID therapeutic drug 2-DZ. 2-deoxy-D-glucose was developed by DRDO. OxyCare, a unique system which senses the individual's SpO2 level and accordingly supplies oxygen from the cylinder. Ministry of Electronics and Information Technology. Arogya Setu app used for contact tracing and awareness about government initiatives. Arogya Setu IVRS system. RT-PCR and RATI mobile app for restricted use by authorized sample collectors. Work from anywhere portal. Secured integrated portal for government employees to work from home. Digital thermometer. E-pass system for easy movement of vehicle during lockdown. Ministry of Commerce and Industry. Enhancing production capacities of essential drugs and other materials, example PPE production capacity, supply of tablets like hydroxychloroquine, paracetamol, etc. to many countries, production of hand sanitizers, licenses and permissions expedited to ramp up production, monitoring of prices of medical devices, oxygen concentrators. Ministry of Consumer Affairs, Food and Public Distribution, PM Garib Kalyan Anna Yojana, PMGKAY, additional allocation of food grain 5 kg per person per month. A smooth procurement of the food grains. Atmanirbhar Bharat package. Under the Atmanirbhar Bharat package, ANBP, Department of Food, Civil Supply and Consumer Affairs had made an allocation of about total of 8 LMT of additional food grains covering all the states and union territories for stranded migrants who are neither covered under National Food Security Act NFSA nor state schemes PDS cards, public distribution systems cards. Ministry of Chemicals and Fertilizers, Availability and Augmentation of Drugs, the Department of Pharmaceuticals DOP actively led the fight to provide drug against the diseases not only nationally but also internationally. Availability and augmentation of drugs, the Department of Pharmaceuticals actively led the fight to provide drugs against the disease not only nationally but also internationally. Pricing. The National Pharmaceutical Pricing Authority NPPA fixes the ceiling price of scheduled medicines specified in the first schedule of the Drugs Prices Control Order DPCO 2013. All manufacturers of scheduled medicines, branded or generic, have to sell their products within the ceiling price plus applicable goods and services taxes fixed by the NPPA. Indian Railways, Shramik special trains, free of cost catering services to migrant travelling by Shramik special trains. Thank you very much.